Today we'll start CPT surgery section, musculoskeletal system. All right. So to understand CPT musculoskeletal system procedures, we need knowledge of anatomy, the surgical anatomy. That is very important. So the skeletal system, the different bones of the skeleton, the axial skeleton, appendicular skeleton. We discussed all this, when we were in ICD, right? And the bones of the skull, vertebra. So you have to revise your the anatomy part, even bones of the hands, lower limbs. At the same time, the muscular system, different group of muscles, the flexors, extensor muscles. Now, this is anatomy that is required, as well as different joints. So, what are the structures in musculoskeletal system? The structures involved in musculoskeletal system. So, under the skin, starting from fascia, muscles, tendons, ligaments, cartilage, right? Those are bones and joints. These are the structures that are involved in musculoskeletal system. So the patient may have problem with any one of these structures. So upon diagnosis, the surgeon will proceed to carry out surgical procedure on any one of the structures. Very important. So let us look at the organization of the CPT codes. So your codes are 20,000 series, 201002 to 9999. It is a code range. So the first what we have is the general codes, 2011002 or the same surgical techniques: incision, wound exploration, excision, introduction. Um, so what do you mean by the general replantation grafts? They can be done on any body area. That's the meaning of general procedures. These incision, wound exploration, excision, introduction, these four plus these three, they're applied for any body area, not just for a head or neck, any body area. But whereas remaining CPT codes, they are arranged based on the body area: head region, neck region, and back, spine. But if you observe the same surgical techniques, incision, excision, there are a couple of procedures which are unique to musculoskeletal system, but remaining all the same. So, what are unique to musculoskeletal system among the surgical techniques? Fracture and dislocation treatments, orthodesis, amputation. Right. These three procedures we did not see in integumentary, if you remember, but remaining all the same. All right. So, likewise, we have guidelines under every heading, under the section as well as the heading. So, let us look at these musculoskeletal system procedures. So we have 11 major topic areas: incision, biopsy, excision of tumors, introduction, repair, fracture. These are the procedures. Likewise, what are the surgical diseases? Every time, whenever we're talking about surgery, we are talking about surgical disease, right? What is necessitating the surgery? That is important. Usually, it is tumor or injury. These are the two important diseases, surgical diseases: the tumor or injury. Plus, it could be abscess, it could be a cyst, right? Or some other degenerative disease. All right. Now, incision procedures. Um, Incision can be done on subcutaneous region under the skin or within the fascia, within the muscle or within the bone. So if you're doing, IND of deep abscess, not within the skin. If it is within the skin, then you have 10,000 cc course. But here IND we are talking about the subfacial or even subcutaneous tissue, not the skin area. Then fasciotomy, so within the muscle, or sometimes the abscess can happen within the bone also. You have to open the bone. That is called osteotomy. Osteotomy is opening the bone. Otomy, the suffix that refers to opening. Osteo refers to bone, right? So these are the incision procedures within different structures like fascia, bone. If it is joint also will be opened sometimes, right? Opening of the joints. What do we call arthrotomy? Arthro refers to joint. Arthrotomy is incision within the joint. So this is how you'll see the codes. Biopsies, very important procedures. So biopsies can be of two types: percutaneous or open. Percutaneous meaning closed procedures. The surgeon will be using only needle, not the knife. If the surgeon is using the knife, then that is open procedure. So percutaneous biopsy, like needle biopsy through skin without open incision. Um, so let us see how we'll find the codes. For example, there is a tumor in eye region, or let's say arm region, right side. Where is the tumor within muscle, muscle of the arm region? So what are the muscles in the arm? You have the major muscle like deltoid, right? These are the different muscles you find in the arm region, upper arm. So what is done is percutaneous biopsy of tumor. Now, whenever you talk about the tumor, yeah, you should also talk about the size. What is the size? So let us say this is 2 centimeters tumor. Percutaneous biopsy of the tumor. Let me put it here clearly. BX means for biopsy. So we have to find the CPT code. Can you try to find the CPT code for percutaneous biopsy of the tumor, arm region? So what are the steps? First thing, we have to go to the this general section. If you don't find it in general section, you have to go to the upper arm section, or vice versa. You can directly go to arm section. If you don't find it there, you can come to the general section, right? So for your convenience, let us go to the upper arm. So after the shoulder, then we have the upper arm. So biopsy, to find the code for biopsy, that is excision, is nothing but excision. So let us go to the code ranges 24065, page number this is 163. So just follow me. So here is the humor, upper arm and elbow. The heading starts. The elbow area includes the head of the neck of the radius and the electron process. So not only upper arm, but also part of the elbow also is included in this particular heading. Excision, we are talking about excision biopsy. So do you have codes 24065? Biopsy soft tissue of upper arm or elbow area, superficial. This is deep subfacial or intramuscular. So here we have two codes. So exactly it is matching, but there is a difference, right? What you find here, these are all open biopsies, not the closed biopsies. If needle is not mentioned, you have to take it as open biopsy. And we have one note within the parenthesis. For needle biopsy, soft tissue use 20206. So this is percutaneous, means it is with needle. That's what you need to understand. Now what do you do? We go to 20206. Like I said, the general section. So biopsy, muscle, percutaneous needle. This is exactly matching, right? So these general codes, it is just not only for arm, but any body area. So your final code is 20206. With you can give RT modifier to indicate the right side of the body. So this is how you find it. Every time look for the code under general section. If you don't find, you can go to particular body area or vice versa. You can directly go to body area. If you don't find, you can come to this general section. Either way. So any questions up to biopsies? So this way you can find code for biopsy of, yeah.
Would you mind to confirm the needle one is open one?
Needle means if you're using needle, that means it is not open. It is percutaneous. This
Okay.
20206 is biopsy muscle percutaneous needle. And we have other instructions also. If imaging guidance is performed, so imaging guidance like, what are the imaging guidance?
X-ray, CT scans.
Yeah, X-ray, CT scan, MRI.
Right, fluoroscopy, CT scan, MRI, or ultrasound. These are the imaging guidance. But again, there is when it is used, when imaging guidance is used, what do you call that procedure?
The knife one, close one. I mean the open one.
No, open is open. That is totally a separate category. This is
Okay.
closed. This is closed. If you don't use imaging, you have to give only this code 20206. But if imaging guidance
FNA.
is used, 20206 plus you have to use another code from 70,000 series for imaging guidance. So what do you call this
Uh,
procedure?
FNA.
FNA is again, that is FNAC, aspiration. This is biopsy, this is aspiration. Aspiration is you're drawing fluid from the with the help of syringe. That is FNA. FNA A indicates aspiration. There is biopsy. Biopsy means with a needle you're taking the tissue. That is meaning of this 20206. The question here is you can do biopsy, needle biopsy without imaging guidance, with imaging guidance. Under what circumstances the surgeon will use imaging guidance?
If it is a deep,
If it is deep, you're not
And
sure
when
where you are,
you really focus on the
right?
particular specific tissue.
Right. If it is deep, or you're not sure where your needle is going.
Yeah.
That's when you use imaging guidance. So you can clearly see in the monitor your needle is exactly in the tumor. That is imaging guidance usage. Now, if you use imaging guidance, the question here is Now here, what we are doing, one is we are using needle plus we are using imaging guidance also. So what do you call this procedure? There is a question. This is nothing but IVR procedure,
Yeah.
interventional radiology. So in IVR, you do a procedure under imaging guidance. That is IVR procedure. Here we are talking about IVR procedures related to musculoskeletal system. IVR procedure can be done in any organ system, musculoskeletal system, respiratory, cardiology, urology, gastroenterology, every system. So just remember this note. If you do any procedure under imaging guidance, that is IVR procedure. Here you have to use, for needle, putting needle, you have to use code from surgery section 20,000, 30,000, 40,000 series. For imaging guidance, you have to use a code from 70,000 series.
So, sir, when we say that most of the time we hear that today this surgery we are doing with the laser, so that's the IVR?
Laser is different.
Okay.
Sometimes it can be an IVR if it is used for visualizing, but laser is different. Laser is a technique basically, but if you are doing laser procedure under guidance, then that becomes an IVR. Okay, laser is like your knife. What you with the help of knife you cut, right? Same thing with a laser you destroy something. All right. So this is so the same biopsy we have seen cutaneous needle biopsy as well as open biopsy for one particular muscle. But the same biopsy, two types can be done for any of these structures. What I mentioned in the beginning, the structures including muscle, bone, joint, cartilage, ligament, any structure. So the process is same. First thing you should know the body area. Are you doing procedure in the head region or in the upper limb or the lower limb? And which structure? How you are doing it? Is it closed or is it open? That's how it. All right. So next to biopsy, then excisions. What is excision? You know, right? Excision is taking out part of the organ or entire lesion. That is excision. Excision is taking out entire lesion or part of the organ. That is excision. So in the same example, so you're done biopsy here, percutaneous biopsy. You send it to lab. Now you have the lab report. Lab report says this is um, benign tumor. Let us assume this is benign tumor. It is not cancer. This is the HPE, histopathological examination says benign tumor. Now the surgeon he wants to do excision. This is different date of service. Okay. Now, so excision it's only open procedure. For this. Or if it is abdomen, they can do laparoscopic. That's a different thing. But here, excision means mostly it is open procedure. Now, because you have to cut open the muscle, then take out this 2 centimeters tumor. That is excision. So what do you do? What is the procedure again? We have to go to the specific body area. That is arm, upper arm. So here we are in the upper arm. We are going to the excision. Now, always in this particular heading, you have the biopsy codes first, followed by excision. 24075, excision tumor, soft tissue of upper arm or elbow area, subcutaneous less than 3 centimeters, subcutaneous 3 centimeters or more, 24071, and 24076, excision tumor, soft tissue, subfacial, that means intramuscular, less than 5 centimeters, 5 centimeters or more. So you have one, two, three, four codes. These are the suggestions. So what do you think? Which code you want to pick up?
Less than 3 centimeter.
Less than 3 centimeters, we have two codes, 24075 and 24076.
Because we choose that subcutaneous. So the first one.
We have to, yes, where is the tumor in this? 2 centimeters tumor within muscle. So if it is within muscle, then so examine these two codes carefully, 24075, 24076. So this is intramuscular, right? Subfacial or intramuscular. This is within the muscle. So your code is 24076.
Sir, what is the difference between subcutaneous and subfacial? Because subcutaneous is the third layer of the skin,
Hmm.
like the first
Yes.
one is. So where is this uh, subfacial one?
Yeah. So here, for example, so the skin, we know we have two layers, epidermis, dermis. Under this, we have the subcutaneous tissue. So if the tumor is here, this region, this is subcutaneous. Under the subcutaneous, you have the different muscles, right? These are the different muscles. So if the tumor is within the muscle, that is intramuscular or subfacial. Subfacial means below the fascia. What is fascia? The covering layer of the muscle.
Muscles.
So subfacial means it is within the muscle. So there is a thin space between subcutaneous tissue and the intramuscular region. Sometimes filled with fatty layer. So, but surgeon will write clearly: is it subcutaneous tumor or within the muscle? If it is within the muscle, the surgeon will write the name of the muscle also. What muscle is it?
Okay, sir.
All right. So
So since it was the within the muscle, that's why we are taking the intramuscle code.
correct, correct, correct. Intramuscular. So every time you have to look for the possible codes from your selection. Then you have to go through each code carefully. Then they select the final code, and you have to assign appropriate modifier also. Usually in musculoskeletal system, you will assign this RTLT50 modifier. Most of the time, because most of the organs there have laterality, right or left. So this excision of the lesion can be done not just in muscles, but it can be done in for the bone or within the joint and in any body, shoulder, upper arm, forearm, the lower leg also, lower limb, any area. So all that you need to know is, so first thing you have to ask the question, which body area and which structure and what type of procedure is it. Is it incision or excision or graft? Then also you should consider what disease is it. It is useful sometimes. Yes, it is useful, of course. So this is excision, then introduction or removal procedures. So introduction, when you say introduction, what is introduction? Introduction of any material. It could be a drug, it could be a device like catheter. That is introduction. Removal is taking out a device, a catheter, which is already existing, which is already placed in the past. That is removal. It can be under introduction, you'll find certain injection of drugs. Like, there is a condition called trigger point where the patient will have pain in particular muscle area, tendon area. That is called trigger point. Then the surgeon will introduce drug injection like painkiller or cortisone into the muscles or joints also. You'll find the course on introduction. Or foreign body removals, implant removals. So we can actually examine this particular arm area, upper arm area, incision, we have excision procedures, then introduction or removal. So 24160, removal of process. Process means there's an artificial structure. It could be metallic or ceramic. That's already placed. Now they're removing it. Then what follows is another heading: repair, revision, reconstruction. Then fracture, dislocation treatments, arthrodesis, amputation, other procedures. That's the end. That's the end of the body area. So same methodology is followed for every body area. So this you need to understand how the headings, how the procedures are arranged under every body area. Then your navigation, browsing will be easier. So this is a major part. If you understand this, finding code is easy. You don't need to go to the index also. You can straight away come here. So repair, revision, reconstructions. But the basic, like I said, yeah, the anatomy part, structures. Because here under repair, maybe injury. Due to injury, maybe tendon is ruptured, ligament is ruptured, or muscle is ruptured, or bone is injured, joint is injured. So the surgeon has to do repair, right? Repair of the particular structure, muscle, tendon, ligament, bone, joint, or whatever. So that is repair, initial repairs. What is revision? It was already repaired once. Again, there was problem. They are doing revision. That is revision. Repair. How do you do repair? Suturing. You go to the particular area. You reach the particular body structure. Suturing material with a thread. You stitch it. That is repair most of the time. But what is reconstruction? Is more extensive than the repair. Extension to repair. So sometimes reconstruction you have to use grafting. For example, tendon ruptured, but tissue is not lost. You do just stitching. That's it. But if the tendon is a portion of the tendon is lost, what you have to do? You have to reconstruct it. You have to take tendon from another body area, put it here, and you have to do reconstruction. So you have codes, for example. repair, revision, reconstruction under upper arm area. Sorry, we almost came to we are in the shoulder area, right? We're talking about upper arm. Yes, we are in the upper arm. Excision, repair. So 24301 muscle or tendon transfer. This is musculoskeletal system among all the surgical CPT sections. Some of the procedures in musculoskeletal system, they're a bit tough because it's all about anatomy. Because there are so many tendons, so many muscles, so many bones. Initially, you find it difficult, but you have to get used to the language. That's important. 24301 muscle tendon transfer in the upper arm or elbow region, and 24305 tendon lengthening. The stenoplasty. Plasty is again repair. So these are the different types of repairs. Here we see tendon repairs, tendon repair of muscle. Then this is ligaments. Here we are talking about ligaments. So in this heading only you see repairs of muscles, tendons, ligaments, this structure that you find in the arm. So that's how it is organized. This repair heading is very lengthy. Under repair, you not only find the simple stitching, but also even joint replacement, extensive procedures like joint replacements. So what are the possible joints where replacement is done usually? Every joint can be replaced. So that's the reason you have ports. For example, here we are in the upper arm elbow joint region. If you see here, 24360 arthroplasty, arthro refers joint, elbow joint with membrane. So here they're totally replacing the elbow joint. 24362 with implant and fascia, late ligament reconstruction. 24360 with distal humerus and proximal ulnar prosthetic replacement. Total elbow. Total elbow is replaced in 24360. So they can replace total elbow or one component of elbow. But codes are from 24362, 24366. So you have to spend good amount of time because it is musculoskeletal spread all over the body, right, from head to toe. For example, if it is unlike other systems, if it is respiratory system, for example, it's only confined to chest region, head and chest region. You have only few organs, but musculoskeletal is not like that. Muscles, bones spread across the body, all over the body. Uh, Initial replacement of elbow joint, these codes. But what happens after 1 year, 2 years? Sometimes there is a problem, right, with implant. Maybe get infection or dislodgement, pain. That's when you have to do revision. 24370 revision total elbow orthoplasty or one component 24371. So this is how your repair codes are arranged, including joint replacements. You can go to knee region, you'll find the same thing, knee replacement. Yeah, you can use index also, but if you flip these pages a couple of times, you find it easy that to directly go to sections. Now coming to the um, fracture dislocations, treatment of fracture and dislocations. So, what are the types of fractures? If you remember ICD, you had the discussion.
Open fracture and closed.
Yes, open fractures and closed fractures. Also, we have pathological fractures and traumatic fractures, right? So, irrespective of the type of the fracture, the treatments, again, we have the classification of the treatments. Here, we are talking about the treatment, type of the treatment. So, we have three types of treatment for fracture or dislocation: closed treatment, percutaneous fixation, open treatment. This is for fracture and dislocation. Now, I'm sure you are visualizing what is fracture, what is dislocation, right? Fracture is breakage in the bone, that is fracture. Dislocation is the joint, the bone.
Shifting.
Yes, the bone alignment within the joint is displaced, that is dislocation. Let's look at the close treatment. Imagine in the forearm, what are the bones in the forearm? Or what is the bone in the upper arm? So when you talk about fractures, you should know the bone name of the bone. What is the bone in the upper arm?
Humerus?
Humerus. Yes, very good. And what are the bones in forearm? There are two bones in the forearm. Yeah, I mean, you can see
It's
in
a
your
down,
PDF,
it's a radius.
radius and ulna.
Ulnar radius. Okay.
So these name bone names you should know. By the time we finish this musculoskeletal system, you should know most of the bones in the entire human body. There are small bones in the skull. That's okay if you don't know. But major bones, the visible bones, you should know. Visible in the sense when you take cut section, it should be visible. That is. Uh, Now, post treatment. Let us say patient has humerus fracture. All right, this is humerus fracture. So this hash indicates fracture, humerus fracture. Where is the fracture? Again, humerus, every bone has different parts, upper end, shaft, lower end. That is important. So here we are talking about humerus shaft. Which humerus is it? Right humerus. Now, patient is with fracture, right humerus, shaft. How it is treated? Close treatment. What do you mean by close treatment? So you don't open it. You just apply bandage, dressing, plaster Paris. The intention is immobilization. If the patient doesn't move his upper arm, the expectation is within 6 weeks it has to heal. So that is the object of this POP immobilization. That is called close treatment. Close treatment can be done in two ways. So what are the ways without manipulation? With manipulation. So you're going to come across these two things: without manipulation, with manipulation. What is manipulation? Forcible movement. The surgeon will try to adjust the bone fragments in the humerus because humerus is fractured. That is manipulation. So here in the arm region fracture and dislocation, The very first code, 24500, close treatment of humeral shaft fracture without manipulation, and 505 with manipulation. You find similar codes for every bone. Please remember, for every bone you'll find similar codes. But if it's open fracture or fracture is very complex, if you cannot treat with POP, the surgeon will go for the other methods like percutaneous fixation, open treatment. Percutaneous fixation means yeah, for example, this is upper arm. So this is, for example, this is the humerus, head, neck, shaft, and lower end. So here is the breakage. This is the right arm. Close treatment we already discussed. Just apply POP. That's it. But what is percutaneous fixation? Now the surgeon put needles through the skin like this. This is percutaneous skeletal fixation. Pin screws placed through the skin without opening site. If it is required, you can use fluoroscopic guidance. So when you put these pins, screws, what happens? This portion will be aligned. So 6 weeks they keep it like this. Then within 6 weeks, this will heal this fracture. But if surgeon thinks this is also this doesn't give results, he will go for the open procedure. Open procedure is you will cut open the skin, expose this bone, then put plates and rods, plate and screws. That is called open reduction and internal fixation, or if this is full surgery to be done in the operation theater. So you'll find, for example, to the same humerus, this treatment of humeral shaft fracture with incision of intramedullary implant. There are different techniques. But, these are all open procedures. If it is percutaneous skeletal fixation, 24538. So there are multiple codes. The coder should have bit of knowledge as to how this surgery is done. That means you need to have experience in orthopedics. But for CPC, as long as you're able to match the terms, match and map the operating report, the terminology with the terminology given in the CPT code, you're good. But you have to, yeah, you have to work. So this is about fracture dislocation treatment. Same type of treatment for even for dislocations also, joint dislocations. Closed, percutaneous fixation as well as open treatment of dislocations. I hope you're taking some quick notes. But anyway, this PPT is available for you, and I'm recording the session. So this.
Sir, what is arthrodesis and
Yes,
amputation, please?
yes. So arthrodesis, amputation, right? The next topic actually, but we'll discuss now. Arthro refers to the joint, right? Like we discussed, this is humerus, and here is the elbow joint where you have the radius and ulna. You have two bones here. This is elbow joint. Elbow joint is formed with the help of humerus, lower end of the humerus and upper end of the radius ulna, right? This is elbow joint. Imagine a patient is, let's say you have arthrodesis in this procedure, in this arthrodesis. Yes, arthrodesis, elbow joint, local. And there's some, in some diseases, what happens, the patient will have severe pain in the joint if there is no option, because the pain is caused by the movement. The pain is caused by the movement. So disease means fusing. So what they do, they fuse these bones. There won't be any movement. If there is no movement, there won't be any pain. So that is arthrodesis. This joint fusion, orthodesis. Ortho is joint, desis is fusion. So this fusion of joint can be done in any joint area. That is fusion, orthodesis. So you have very limited number of codes for every joint. Now coming to the amputation. We are talking about this is upper arm, this is lower arm, right? And what you find here is there's a wrist joint, and you have hand as well as these are the fingers, 5 fingers, right? The 5 fingers. So imagine a patient is working on a machine, power machine, and he cut his wrist like this, totally separated. This hand is totally separated from the forearm. Only a portion is intact. So what are the options here for treatment? So either if you have a plastic surgery or plastic surgeon is available, if there are enough resources, they can do replantation, hand surgery. It is possible. If this portion is viable, if the surgeon thinks this will work, then he will do replantation, right? But if that is not possible, this entire already some portion is gone, then remaining also he will cut. That is amputation. So the patient has to live with this stump. It is called stump. So this hand is gone. That is amputation. So this amputation can be done at any level, at hand level, at elbow level, or at upper arm level. So amputation is mostly for, this is only for either upper limbs or lower limbs amputation. Not only these injuries, but also even diabetic complications sometimes, So total leg will not be viable. They'll cut. That is amputation. Yes. Any questions, please? So this is amputation. So these are the procedures that you find in musculoskeletal system. Finally, we are at arthroscopy. Scopy is an endoscopy procedure. So endoscopy, right? Keyhole surgery. You're doing this keyhole surgery in joint. As a reason, it's called arthroscopy. So please, you can watch. Just explore how arthroscopy is done. Um, for example, this is so this is the right shoulder joint. This is the right shoulder joint. Imagine this shoulder within the shoulder, there is a ligament that is gone, that is ruptured. You have to do repair. There are two ways. One is open method. You can cut open this shoulder joint and you can do the repair of the ligament. that is possible. That is more extensive procedure because you are giving big incision that is open to repair the ligament. But instead of opening, you can do arthroscopy also. In arthroscopy, they don't open this big. So instead, what they do, they'll create, three small holes. So one hole they'll pass camera, long tube, which is attached to the camera. You'll be able to see in the monitor where you are because there is a camera at the end of the tube. From one hole they'll pass instruments, and through the another hole also they'll pass certain instruments. So with the help of these instruments, while visualizing in the monitor or in the eyepiece, there's an eyepiece to the camera. While watching it, they can do this procedure. This is called keyhole, minimally invasive arthroscopy procedure. What are the advantages? Because opening is not big, small openings. Quickly they will heal, not much hospitalization. Next day, patient can be discharged. So minimal post-operative complications. So these are the advantages for arthroscopy. So where do you find what is the series of codes? 29,000 series codes. Shoulder arthroscopy 29805. Elbow. These are the arthroscopy procedures. They can do repair, a lot of repairs they'll do. Mostly repair of the ligaments, cartilages. So go through these arthroscopy 29, 2980022 9999. Very important. And of course, easy to understand. And any endoscopy, including arthroscopy, is of two types: diagnostic and surgical. Diagnostic and surgical. Please remember these two words: arthroscopy, any endoscopy. Endoscopy is, upper G endoscopy, colonoscopy, bronchoscopy, all those, including arthroscopy. There are two types: diagnostic and surgical. We have separate course for diagnostic arthroscopy, separate course for surgical arthroscopy. What do you mean by diagnostic? Any idea? Can you guess? Or maybe you know it already. So diagnostic means you just go inside, see what's happening, and come out. That is diagnostic. You don't do anything. At the max, you do some washing. That's it. That is diagnostic. Whereas surgical means you go there. If you find something, you do the repair. You do some repair, reconstruction, or whatever. That is surgical. So when you do orthoscopy, anyway you have to do diagnostic first, followed by if there is a abnormality, you have to do surgical. So here we have one rule. Please make a note. The rule is, in any endoscopy, diagnostic endoscopy should not be coded along with surgical endoscopy code. Diagnostic endoscopy code should not be assigned along with surgical endoscopy code. This is the fundamental rule, very important. Let's go to the arthroscopy codes 29805, the very first code. Let us look at arthroscopy shoulder joint. Please go to 29805 in your book. Yes, 29805 arthroscopy shoulder diagnostic with or without senile biopsy. They're not doing much. They're taking maximum biopsy. That's it. That is 29805. But remaining all surgical. Arthroscopy, shoulder, surgical, capsulorrhaphy, slap lesion repair, they're all repairs. Extensive procedures. So you'll find the same arrangement in every joint. Diagnostic arthroscopy of elbow, surgical arthroscopy of elbow. Knee joint also same thing. Diagnostic arthroscopy knee joint, surgical arthroscopy of the knee joint. So hardly you
Sir,
have, yes please.
the rule which you just mentioned for the endoscopy, it will be applicable for arthroscopy also or no?
Arthroscopy also. Not
Okay,
only
so
arthroscopy, tomorrow we are going to discuss about different types of endoscopies. It is applicable for every endoscopy.
okay.
It can be bronchoscopy, colonoscopy, whatever. Arthroscopy also. You should not give these two together. Diagnostic arthroscopy should not be coded along with surgical arthroscopy for all these codes. So you are going to use RTLT modifiers every time. Right, left, right shoulder, left shoulder.